We've got 77 degrees in Aurora at 5:51. It's time for Marketplace.
Millions more people are going without health insurance, and we begin a look back at 250 years of the American economy.
Marketplace Morning Report is supported by Odoo.com, providing business management software with integrated programs for accounting, manufacturing, and operations. Odoo, all your business on one platform.
From Marketplace in Washington, I'm Kimberly Adams. About 3 million fewer people have Affordable Care Act insurance now compared to last year. That's according to data from the Department of Health and Human Services that goes through February. Initial sign-up data from earlier in the year showed a drop of a little over 1 million people. But these latest numbers indicate that many who enrolled in ACA plans this year likely didn't pay their premiums and have since lost coverage. Marketplace's Samantha Fields has more.
The Trump administration is attributing most of the drop in ACA enrollment this year to a reduction in fraud. But most experts say there's no evidence of that, including Sabrina Corlett at Georgetown's Center on Health Insurance Reforms.
It's a simple economic fact that when you raise the price of a good or service, fewer people will enroll.
ACA premiums went way up for millions of people this year after Congress let the enhanced pandemic-era subsidies expire. And Lindsay Allen at Northwestern University says because of that,
there are not as many people signing up. And then there are people who are re-enrolled automatically but aren't able to pay the premium, so they'll be disenrolled.
And it's likely people will continue dropping off as the year goes on, especially healthier people. Sabrina Corlett at Georgetown says there's already evidence that this steep drop in enrollment will lead to further increases in health insurance premiums next year.
It's early days yet, but what we can say is that what the initial rates that are coming in to state regulators, we're looking once again at double-digit rate increases.
Because she says when insurance companies have a smaller pool of sicker people they have to cover, their costs go up, so they raise premiums. I'm Samantha Fields for Marketplace.
Staying on the topic of healthcare, starting tomorrow, Medicare will begin covering GLP-1 drugs for weight loss. Patients will be able to access drugs such as Zepbound and Wegovy for a $50 monthly copay, much less than the hundreds of dollars the medications typically cost out of pocket. Marketplace's Nova Safo has more.
Medicare begins an 18-month pilot program tomorrow, providing GLP-1 drugs for weight loss. It is a pilot because Medicare under federal law has the ability to launch temporary programs, but can't cover weight loss drugs as part of its permanent Part D prescription drug coverage unless Congress changes the law. For now, Medicare will allow some patients through this pilot to access GLP-1 weight loss drugs for just $50 a month. Patients won't have to meet a deductible before that price kicks in, but they also won't be able to count the cost toward reaching their out-of-pocket spending cap for the year. To be eligible for coverage, patients must have a body mass index of 35 or higher, or must be diagnosed with one of a number of diseases. The health policy nonprofit KFF says nearly 4 million people could benefit. I'm Nova Safo for Marketplace.
Let's do the numbers. The FTSE in London is up 1 1/10%. Dow, S&P, and NASDAQ futures are up in the 0.1% to 0.2% range, with the Dow future up 60 points. The 10-year Treasury yield is down at 4.37%.
Marketplace Morning Report is supported by Progressive Insurance. Progressive offers its customers the option to bundle home and auto insurance all in one place and provides customized protection for what matters most. Learn more online at Progressive.com or 1-800-PROGRESSIVE. And by Bitwarden, designed to strengthen online security for businesses with a password manager built to secure logins across all accounts and devices. Bitwarden.com.
As we prepare to mark the 250th anniversary of the United States, we're taking a look back at some of the defining moments that have shaped the American economy and how the choices made throughout our history shape the economy we live in now. Today, the first 50 years of our nation. We begin with money itself, which in the early republic was still in flux. States were printing their own currency, war debts were everywhere, and there was barely any credit. Enter the first Bank of the United States. Historian Jonathan Levy says the goal of the bank was to ease the credit problem stemming from the Revolutionary War and its aftermath, with the added benefit being
partly privately owned, privately subscribed, so private citizens could own the stock of the first bank in the United States. So it was very much a split public and private institution that both had a monopoly on the banking business of the United States government, but also made loans to private individuals to try to spur and support American commercial growth.
But not everyone saw it that way. To some of the era's biggest names, the bank wasn't a solution. It looked more like a betrayal of what the revolution stood for.
Thomas Jefferson thought that mutual interdependence was corruption, a corruption he identified with the British Empire, which was precisely the empire that the revolution had been fought against.
That same credit system would soon be used to finance the domestic slave trade.
What made possible the domestic slave trade was a very sophisticated mode of financing it. Credits made available, Southern banks are chartered, slaves become the principal form of collateral for the Southern credit economy, through mortgage markets, through credit markets, through currency markets.
The system Levy refers to was sophisticated and brutal and came at an enormous human cost. People were bought, sold, used as collateral for loans and investments, while providing the foundation for much of the nation's economic growth. Slavery also laid the groundwork for future economic and political divisions that risked the future of the country itself.
Most lasting characteristic of the first 50 years that's still with us is the conflict between capitalism and democracy.
That tension that Levy refers to shows up again and again in the fight over banks, in who could vote and participate in politics, and who was able to profit from the nation's economic dynamism. It's a tension, Levy says, has never been fully resolved. That was Jonathan Levy, professor of history at Sciences Po in Paris, on the first 50 years of the U.S. economy. Tomorrow, a look at 1826 through 1876 and the Second Industrial Revolution. Our producers are Emma Condon, Tamar Fagan, Ashley Rodriguez, Ariana Rosas, and Erica Soderstrom. Our senior producer is Alex Schroeder. Our supervising senior producer is Meredith Gerritsen-Norby. In Washington, I'm Kimberly Adams with the Marketplace Morning Report. From APM, American Public Media.